All right. So next, what we're going to talk about is substance abuse. There's definitely an increase in substance abuse. People are at home, they're bored. There's not much on TV these days. A lot of people have canceled their cable TV because they're not making a lot of new shows. And you can get things a lot. You can go to Roku and all kinds of things that are cheaper and have the same, some of the same benefits. And so out of this boredom and the stress, a lot of stress, stress from being overworked in fields where you're essential worker, and so these guys are getting worked to death, or not having any work, being out of work. Both cause emotional distress and immediate gratification. It's right there. And so the drug dealers haven't gone on vacation. And so we're seeing significant increases in opiate related deaths and in drug abuse during this pandemic.
Yes, well, the fentanyl usage has gotten out of control. As you know, I'm an emergency room doctor, and since this COVID came on the scene, it's just gotten worse. Everything has gotten worse, and it seems like there's just more patients with more problems and a variety like you haven't seen, and it's compounded by depression and overwork too, and that includes me. And I just needed to maintain to do the service, and then it seems like one thing led to another, and one patch led to another.
Now, in this emergency room physician, there seems to be a little bit of cognitive impairment even there. And if you use opiates, it does shrink the brain over time. Okay. And fentanyl is we got a lot of deaths from fentanyl. Fentanyl, as you probably know, is 70 to 100 times more potent than morphine. All right. Very small amounts can kill you. It can suppress respiration in a very big way. It's very cheap and easy to manufacture. China is manufacturing fake OxyContin pills and selling them on the streets in the United States. This is a fact. And it's cheaper than heroin. And so what they're doing is they're taking OxyContin, putting fentanyl in so people get their high, but it's easy to overdose on fentanyl, much easier. So in 2020 alone, we've got about 50,000 deaths just from fentanyl. So overall, we got about 280,000 deaths from COVID, 50,000 deaths from fentanyl. And so that does include deaths from heroin. That's fentanyl alone. And people are bored, they're overworked, they're underworked, they are dealing with financial stresses, family stresses. So again, people are getting divorced, their kids are not doing well in school, the kids not doing well in school are stressed. And so immediate gratification becomes more difficult to resist. And when these drugs are available, how much, does anybody know how much OxyContin goes for on the street? The street worth? It's from $3 to $30. You can get OxyContin capsules for as low as $3 on the street. And the chance that it will be laced with fentanyl is very high. Okay. So a lot of deaths from this. So substance abuse has really gone up. Many people who were stable are no longer stable in this COVID environment. Okay, so that's something we need to be aware of. When people come in and we look on their history and we see that, we need to ask them if this has become an issue for them, because the risk factors for relapse are much higher. Not only do we have all the stressors that have gone up and the risk factors that way, but treatment facilities, the rehab facilities are limited. One of the reasons that rehab facilities are limited is COVID, okay? All it takes is one patient. You bring them into your rehab facility and they test positive. Guess what? You're shut down for a while. So getting treatment is a bigger challenge in today's environment. Now, briefly, substance abuse and suicide, I'm going to talk about, they kind of go hand in hand, at least in the United States. Why is that? Well, when I take a look at my patients who have suicided, over the last 20 years, I've had, I think, maybe 4 suicides. And most of them, what they had in common were substances. You're talking benzodiazepines are notorious for increasing risk of suicide because benzos block your ability to have hope, to look forward to the future. So benzos are notorious, but narcotics are also notorious, and alcohol is depressogenic. So alcohol and benzos are the worst, but opiates, when it comes to fueling chronic depression and hopelessness, they can do that. All right. So they kind of go together. Worldwide, in the United States, of course, suicides have gone up. Suicidal thinking has skyrocketed. 1/4, there was a study done recently, and I think this was an October or November study, and I think I have that slide later on here. But 1/4 of people 25 and under have had serious suicidal ideation. 1/4. Think about that. 25 out of 100, okay, have had what they describe as serious suicidal ideation. Now, you think that's really horrible. Oh my gosh, the United States, we're horrible because look at all this suicidal thinking. Japan is much worse, okay? In Japan, you have a philosophy, it's pronounced ikigai. Ikigai is made up of two Japanese words, iki meaning life and kai meaning the result. Combined, it means it's a philosophy that discusses a reason for living. And examples in Japan of ikigai are related to aspects of social identity, your work, your family life. Those are the biggest things that contribute to your reason for living. Work and family, your identity, your self-respect. It also includes things like hobbies, friendship, community, and travel. Okay, it's who you are. Now, it's a pretty secular viewpoint, okay? It's pretty secular, and it has to do with your activity levels, your activities around supporting and contributing to your family and your job. In Japan, your job is really, really important. That's where honor and identity are. Now, COVID has whacked that in the head with the crowbar, okay? Think about these things. Work. Well, the economy is devastated in Japan. And so we got people working multiple jobs and still can't make ends meet because they used to have a good job, but those good jobs aren't there anymore. And so they have to take what they can get, or they're unemployed. And so they're not keeping up financially, and they're no longer in that job that they felt respected in. They have to take a more menial job. And so that affects their identity. And family life, families are having a hard time. The number of people, they're like us, the divorce rate is getting higher, okay? And the arguments in that family are going up, obviously, okay? And hobbies, if those are social hobbies, that's not happening. Friendships, people aren't getting together as much, obviously, and travel, forget about it. And so these things, if you have a completely secular worldview and a secular philosophy on self-worth and value, COVID has had a devastating effect on their ikigai. Now, I say that because this is alarming. In this 2020, in Japan, more people have died in the last month than from COVID in all of 2020. In 1 month, more people suicided than all the deaths in Japan in COVID for the whole year. And unlike suicide that we think of normally in this country and other parts of the world, where mostly men, this is led by women. Okay. Now, all of you have had training in suicide, and one of the things that you know is that it's mostly men. Women do suicidal gestures, men complete suicides. In Japan, the women are completing suicides at an incredible rate.
I worked full-time, even overtime, but did not have enough money to live. I worked full-time, even overtime, but did not have enough money to live.
She was working for a publishing company but couldn't make ends meet. Now she works at an NGO, but since the pandemic, the stress she felt then is now back.
My salary was cut, and I can't see the light at the end of the tunnel. I constantly feel a sense of crisis that I might fall back into poverty.
Japanese women are bearing the brunt of job losses from the pandemic, often working in industries like hotel, food service, and retail.
Japan has been ignoring women. It's a society where the weakest people are cut off first.
In October, more Japanese died of suicide than from 10 months of COVID-19, partly driven by suicide among women, which increased 80% from the previous year.
They are suffering so much, they just feel it's better to die.
Koki Ozura started a mental health hotline in March. 70% of the people asking for help are women.
They lost their jobs and they need to raise their kids, but they don't have any monies. They attempt to suicide.
His nonprofit receives about 200 messages a day. Koki says his 600 volunteers are not enough to keep up with the volume.
And I've been messaging, accept messages like, I'm raped by the father, the real dad. Or my husband tried to kill me.
Wow,
Yeah.
because of the pandemic.
Because of the pandemic, yes. Because before the pandemic, they had like the place that they can escape, like the schools or the office.
Japan has long struggled with one of the highest suicide rates in the world, but the number had been decreasing up until the pandemic. The government has invested in suicide prevention, but Eriko says it also requires changing society.
It's shameful for others to know your weakness and misery, so you hide everything and endure. We need to create a culture where it's okay to show your weakness.
Okay, so, a lot of the things that we discussed earlier, they have in Japan, including the child molestation and everything. So this is a worldwide problem, but the domestic problems, the financial problems have contributed greatly to a marked suicide rate. I mean, when you're killing that, way more people are dying from suicide than from this virus. That says something, okay? And one thing that I would warn about in my patients is that if you have a completely secular worldview where your identity and value is based on your job and what you do in life, it's kind of dangerous when facing crises like we have in this pandemic, because those things that your identity is based on can be taken from you. And when you lose those, what's left? If nothing is left, then suicide becomes realistic. Remember, one of the things that we need in life is purpose. We need love and belonging and purpose. Those are the top two things that humans need for fulfillment. And if your purpose is entirely secular, you can lose that in situations where society breaks down and things like this pandemic. And so we need values. We need to get our values from something that doesn't change, such as our spirituality, like God. I think that's a very important thing. And so not everybody can hear that, but I highly recommend it because it does confer significant protection from suicide, because no matter what you lose, you don't lose the most important thing. If you have an understanding that God not only exists, but loves you, and there's hope there. Even if you can't see it, there is still hope. Having that understanding makes a difference. And that what it does protect you from is that abject hopelessness of being on your own and not being able to see any light at the end of the tunnel. And I think that's kind of what they may be experiencing in Japan. Not by everybody there, obviously, but it's very widespread, obviously. All right, and as I mentioned earlier, this is the slide from the Centers of Disease Control looking at suicidal serious consideration in 2020. And as you'll notice, in 2018, only about 11% of young people seriously considered suicide. That's up to 25.5%. Slightly over a quarter of the young population, people ages 18 to 24, have now seriously considered suicide in 2020. And for reasons that I've discussed in this presentation, I'm not going to hash all of them, but yeah, the unhappiness index has skyrocketed in 2020. Now, the excess deaths, we have several states that have actually calculated excess deaths. Excess deaths means if you take a look at the last 3 years, what percentage of the population do you expect to die? Okay, what percentage? And so excess deaths are, if you compare to the last 3 years, how much more or less are they dying now? And Oregon and Washington, we have stats on this. And take a look at Oregon here. In the red, we have COVID deaths. So that's excess deaths specifically from COVID. Notice the blue line, okay? Wow, in August, look at that. We had 200 extra deaths, almost, not quite, maybe 150 extra deaths in Oregon from COVID, over 500 from non-COVID related causes, extra deaths. So that includes other things such as suicide and drug overdose and other illnesses, maybe COVID related illness, maybe grief related illnesses because you lost family members and so forth. So the funeral homes are doing great business these days. And in Washington, the non-COVID deaths are just crazy here. Wow. I mean, it's amazing. So COVID, the COVID environment together is increasing deaths significantly. And as I mentioned earlier, there are fewer resources for drug rehab because of COVID. The overdose deaths in 2020 are significantly higher. Increases range from 25 to 50% increases over 2019.
As you know, I have a heroin problem, and I've been isolated at home, no one around, and it's just gotten worse. I had it under control. I can't take it anymore. I'm all alone, all the stress from losing my job, no one to socialize with, and here I am, strung out all the time now. It's horrible.
You know, and this just stresses because we saw the one. Okay, I'm not gonna go with that. We saw the clip on the emergency room doctor who was overworked and he went to fentanyl to deal with the stress. In this case, this woman here is dealing with the stress, but she's home alone and doesn't have social interaction, and that compounds when you are socially isolated. You're living by yourself in the midst of a pandemic. At Easter Seals, I've got a ton of patients like that, and a few patients like that here at Perspectives. All right, this is horrible because people keep you grounded. When you have somebody you can have intimate conversations with, you can share your life with, it eases the burden of your problems. You don't feel alone, okay? You don't feel alone. And feelings of aloneness contribute to hopelessness, and hopelessness, you know, you go through this something called might as well. And if heroin is available, if fentanyl is available, it's harder to resist that temptation if you're in a hopeless state. Having people to be supportive for you, that you can talk to, it makes a big difference. You know, the things like AA and stuff, those things helped. And you know, there are lots of programs that were very useful in keeping people stable. Well, you don't have Celebrate Recovery, you don't have the AA things like this. And so the factors that promote substance abuse are up, the factors that promote recovery are down. So anyway, there you go. So increased suicide, increased substance abuse, and you're looking here at mental disorders throughout this pandemic. And obviously all the numbers are up. And again, you don't have to be a genius to figure this out. This stuff has been in the news. But what I've done today is just go over the specifics as to why some of the main factors that the COVID pandemic and the response to the COVID pandemic are increasing psychiatric illnesses as far as the severity and impacting individuals' ability for recovery. Okay, so hopefully you can be aware of those things. In terms of, not going to have time to talk about these mitigating factors, but certainly the therapy that you offer, the medication treatments make a difference. For people with resistant depression, we do offer TMS, Transcranial Magnetic Stimulation. And Lindy's going to be talking about that. Basically what TMS does, though, is that we use a high frequency magnetic pulse over the area of the brain called the dorsolateral prefrontal cortex to stimulate that area of the brain. And ultimately what we want to do is bring the executive functions, the logical brain, back online. When you're depressed, you lose weight in that area of your brain. And as a result, problem solving goes down and depression and anxiety become really bad. So by stimulating that area, we try to reverse that through a process called neuromodulation. And Lindy's going to talk more about that next.
So welcome back, everyone. I see Lindy is here ready to share her screen with us. And Lindy is a certified TMS treater and TMS coordinator. She has been working in the mental health field for over 20 years and spent the last 5 years as working in TMS specifically. She earned a BBA from the University of Michigan Dearborn, majoring in human resource management. She currently serves as the TMS coordinator for Perspectives of Troy, where she focuses on treating patients that suffer from treatment-resistant depression. So, Lindy, go ahead and take it away. You're still muted. If you go down to your little microphone on the left.
Is that better?
Yes.
Okay, sorry about that. So let me try that again. So hello, and thank you for taking the time to listen to me talk a little bit about what we can do with TMS for your clientele demographic. So what we're going to try to tie in is when Dr. Guy was talking about how COVID has really changed the landscape of mental health in so many different ways, and all the depression that we're seeing coming out of it, and with the social distancing and the side effects that's just increasing this. So what Dr. Guy does here is a procedure called transcranial magnetic stimulation. And what he already kind of touched on this a little bit during the break, but what it does is it's treating medication resistant or treatment resistant depression. So when people are taking their medication to treat depression, it's either not working for them, or its efficacy starts to wane over time, or they're suffering from side effects that are intolerable at some point. Okay, so what he's doing is we're using a machine that's similar to an MRI machine, and like he said, we're stimulating the particular areas that's housing emotions, and we're stimulating with a magnet that's very powerful, and it's kind of forcing your brain to comply. It's circumventing all the other things that medication has to go through to make it work for you. So what is the ideal demographics for a patient? Oh, I'm sorry, you know what? I'm not advancing the slides. Sorry about that, guys. Oops, that is not in the right order. I apologize. I'm gonna go back up here. Okay, so I'm sorry. So this slide actually talks about and shows you about patients. Every time you change a med, what happens? The efficacy is going down, and then the side effects go up. So this is the correlation with that. So that's kind of what this slide is, what we were talking about when patients are not doing well with antidepressant medication. Okay, sorry about that, guys. Okay, so this is the actual device we use. We use a NeuroStar, and this is kind of like a this is the actual machine and what a patient looks like reclined in the chair. So as you can see, they're not completely encapsulated or anything. They get to recline, they get to relax, they can watch TV, they can do whatever they want during their treatment. This is showing the actual coil. In the upper cam corner, showing the coil that goes over the spot that Dr. Guy determines which needs to be treated. Okay, so this is just showing that how brain activity can be altered through TMS or medication instead of treating going through the whole, like we talked about, systemic through the whole body. This is treating the one area on the brain where it can be more targeted approach. Okay. So what is the optimal patient demographic that we're looking for? So we're looking for people who have tried multiple medications and haven't received the relief that they need from it. So we're looking for people who are suffering from long-term depression without psychotic features, major depressive disorder, and people who want a more of a holistic approach to going forward with their treatment with depression. I'm sorry, kind of got sidetracked here. So when we look at a brain with depression, you can see on the left side, that is a image of a brain that is depressed, and then on the right is the side of once you stimulate that brain with either TMS or with a medication, that is what you can see the activity increases. You can actually see this on a PET scan. I wish we could do this with all our patients to see when they come in and when they leave, so they could actually see the visual of it, but we don't do that here. But this is basically how we explain to a patient, this is what your brain is functioning on now and what we want to do for them with TMS. Okay, so the people that TMS exclude would, the kind of patient, if anybody has any non-removable metal in their head, anything like a shunt or a coil or anything that they cannot be removed, they would not qualify, or anybody who has any kind of ear implants, cochlear hearing aids, anything like that, those would be something that would exclude an actual patient. However, we still would be willing to meet with somebody and talk to them about what their options are, because there are some exceptions to the rule. And that's something that what I do is I provide that communication with a patient. So the good thing is you don't have to know all this information. You can just refer them to us, and I can do in person or through telehealth or through a phone call. I can provide information or give them information, and we can talk about whether they are a good fit or not. Okay, so how would one make it? Oh, and I'm sorry, there is another one. Patients who have a seizure disorder would exclude them from treatment. So how do you make a referral? So making a referral, I do work out of Troy that's where our only chair is right now. And so here's the information. So how you can contact me. You don't have to worry about doing all the legwork, because there is some prior authorization that might need to be done for the patient, but we will handle all that, and we will be in contact with you, because what we're providing for you would allow you to be able to do the work with your patient. So once we start working with a client or a patient of yours, we would be in contact with you, let you know what's going on with them, how their progress is going. And we wouldn't want to lose that communication with you. And then once we send them back to you, the beauty is that they're able to actually do the work. They're able to actually engage in therapy. They're able to make better decisions and understand what you've been telling them. So that is why it's important to think about this as a potential treatment for your patients going forward. And like Dr. Guy was saying, that we're just seeing depression on the rise. We're seeing people are scared to leave their homes. They're scared to go back into contact with other people. This is something that allows patients to come to a safe place, come to a sterile. We're very conscious about how we clean and how we take care of all our equipment and everything. So it gets them out of the house. It is a treatment that is six weeks usually, approximately, if they come every day. So they're going to come every day, and they're going to spend about 20 minutes in the chair. I know it sounds like a big commitment, but if somebody really wants to get better, this is really not that much of a sacrifice for them to do. And like I said, they can come in and watch TV, they can come and listen to music. So this time is really something that's important for them to invest in themselves, especially during this pandemic where people are afraid to go somewhere, or maybe they're suffering from not seeing their family or their friends. This is a place where they can actually come and start getting back in contact with people. It is covered by most insurances. Like I said, we can handle all that on their end for them. They don't have to worry about knowing whether it's covered for them or getting prior authorization from them. We'll get that history from them, and we'll be able to supply it for them. So that is the information, how you can contact us. And Dr. Guy is the supervisor for all the programs, so you don't have to worry. I'm literally just a monkey running the machine. You don't have to worry. I'm not making any big decisions about this. He's going to meet with your clients first. He'll determine if they're a good candidate on a medical level. I'll just do a short screening with them, and then he'll determine whether he feels this is the best route for him. And then once that happens, then we'll begin treatment. And like I said, we'll be in contact with you. So you please feel free, ask Dr. Guy. He will have much more detailed answers about the actual medical side of the treatment itself and how it works on the brain. If you have any other questions, you can also contact me through this. So I will pass it back to Dr. Guy, although I think it's, There he
Sounds
is.
good.
Okay, so Dr. Guy will go ahead and answer questions about both the his talk he just gave and any questions about you might have about TMS.
All right. Well, thank you everybody for all those who said thank you. You're welcome. Okay. Do we have any questions? So let me address some of the questions here. Let's see here, because it's in the chat here. All right. Okay. All right. I think I found my first question. It says, what dose for melatonin? It doesn't take it when it comes to stimulating immunity. It really, even if you take a look at what happens to blood levels, even 1 milligram will give you enough. We're talking about the levels that you have as a young person are measured in picograms. So even 1 milligram will give you the immune protection of a 25-year-old. You don't need to use high doses. It's not like if you're treating something like gastroesophageal reflux, then you want to use like 6 milligrams and above. But when you're talking about immunity, even very, very low doses are okay, which is good. The reason that's important is that if you have an autoimmune disorder, you can make it worse with melatonin. So if you have rheumatoid arthritis or serogens or lupus or multiple sclerosis, melatonin use can make your autoimmune disease worse because you have an overactive immune system and now you've made it more active, okay? So when you're trying to fight this virus, I found that if I took 6 milligrams of melatonin, I thought maybe more is better, and my arthritis went nuts, okay? So you don't need all that. 3 milligrams is plenty, and if you can find it in 1 milligram, if you have autoimmune disorders, I would stick to 1 milligram. You're going to get very good benefits like that. So it doesn't take very much at all for immune stimulation, okay? Next question. See, that one was from Susan Friesner. This next one here, let's see here. Okay, from Ann Sliter. Okay, are people with autoimmune disorders more or less likely to contract COVID-19? There have been a couple of studies and they show that they are no more susceptible than the general population, okay? Now, if they are currently taking steroids, that would suggest that they're at higher risk, okay? Because steroids reduce immunity, so that could potentially increase your risk. However, no, they've looked at that in the few studies that have been done, and so far, there has not been shown to be any increased risk with autoimmune disorders, even with steroid use. So we don't have evidence for that. It stands to reason that it should, but we don't have evidence yet that that's the case. Dr. Ruby J. Bowen said, blood donations are much needed. Once you donate blood, it takes your red cells 4 to 8 weeks to replenish. So during that time, is a person more susceptible to contracting COVID by donating blood? Well, if they don't take out too much blood, okay, if they're overly aggressive and take out more blood than they should take out, well, that can not necessarily increase your risk of COVID, but if you do get severe COVID, your symptoms are going to be much worse because you compound the effects. We know what COVID does to red blood cells, and if you have a smaller red cell pool, that can make the symptoms worse. In terms of susceptibility, nobody's looked at that, and given that they normally don't take extra blood, I doubt that normal blood, donating normal blood is going to cause your risk factors to go up. It doesn't make sense because they don't take that much, okay? David Grobel says, are we able to have access to the PowerPoint after? Yes, I'm putting this on YouTube, presuming, of course, everything copies like it's supposed to and no obstacles. I will be putting it on YouTube, okay? Henry Paulson, if someone is on a regularly utilized melatonin supplement, especially nightly for sleep, does that individual have the increased protection in place already? The answer is yes. You don't have to change the dose. Even small amounts boost your immune system a lot. So they don't have to change anything. Just stay on their normal dose and they will get the impact. So it's not one of those drugs where you have to change the dose for efficacy. Even a small amount, even if it's regularly used, you will have enhanced immune response, okay? If a person, this is from Ann Slider, if a person has multiple risk factors like congestive heart failure, diabetes, and then gets a mild case of COVID, are they more likely to have neurological symptoms or long COVID? No, as long as it stays mild. So if they are using mitigation strategies, if they have a strong innate response and it doesn't go, if you keep that virus under control early on, that's the important thing. Keeping that virus in its infancy stages so that your adaptive response can kick in and kill it, okay? Now, the thing is, if you have diabetes, your immune system is weakened. So I have to say that your likelihood of more severe COVID is higher with diabetes because of that, okay? So that is a problem. With the other two, not so much, not so much. But diabetes, yeah, that is actually a pretty nasty risk factor for more severe symptoms and therefore long COVID. Okay. Sherry Dickinson says, my brother had COVID in the spring. He still has brain fog. Should he be taking iron pills? If so, how much? Well, really that varies. Excuse me. With regard to long-term sequelae of COVID infection like that, sounds like he is in long COVID there. That does strongly suggest that. The virus itself has probably done its job and it's over, but we have long-term effects here. What we want to do is enhance his body's ability to make normal red blood cells. So you want a diet that is conducive, and I would recommend iron supplements such as ferric oxide, iron oxide. That's a very good thing. It's like 600 milligram doses there. So that's a good one. Another good one to help get over that is N-acetyl cysteine, and I'll talk about that briefly toward the end. But there are many things. What you want to do is increase the brain's recovery from this process. Because keep in mind, his brain has taken a huge hit. And so generally speaking, it doesn't have a lot of brain-derived neurotrophic factor, and therefore the synapse density most likely has gone down. Microglial activation is probably still high. So in order for him to get rid of that brain fog, you need to get rid of all the brain inflammation. You need to get rid of all the damaging oxidative processes. So I highly recommend large amounts of natural agents to do this. N-acetyl cysteine is one, at least 1,800 milligrams a day of N-acetyl cysteine, phosphatidylserine to increase synaptogenesis, even things like aronia juice, okay, or aronia berry capsules to increase brain-derived neurotrophic factor. And so there are a number of things like that. I mean, that's a pretty long list, but yes, there are a number of things that you can take by mouth to stimulate the recovery of his brain, and we'll talk about those as we go later in the program here. Okay, let's see here. Is it the melatonin or the fact that the melatonin produces a deeper, longer sleep? It's absolutely the melatonin. Okay, the sleep is beneficial, but in terms of its effects on the immune system, it is melatonin directly stimulates hematopoiesis and lymphopoiesis, and so it actually literally stimulates your immune system to make more immune cells. It stimulates those cells to jump into high gear and to be more aggressive in terms of cytokine production. So it literally is. Melatonin directly stimulates your immune system. Certainly the improvement on your sleep is incredibly beneficial and does benefit the immune system, but melatonin specifically affects your innate immune response, even without the sleep, okay? Let's see here. What brand of melatonin? It's a very simple molecule. It's very simple. It doesn't matter the brand. As long as they're giving you the actual product, it absolutely does not matter. And again, if you can find it in the 1 milligram dose, awesome. For those that have autoimmune disorders. If you don't have an autoimmune disorder, then the 3 milligrams is a safe dose that's pretty standard. You can get that almost anywhere. Don't spend a lot of money on this. It's at higher prices. You're not getting much for your money at all. Okay, so I don't recommend going all out and getting fancy brands of melatonin. It's a simple molecule. All right. Does the coronavirus increase or decrease apoptosis? Absolutely increases apoptosis of the red blood cells. Because of the iron dysmetabolism, it literally causes apoptosis. It causes that of the red blood cells. So yeah, it increases apoptosis. Okay, my husband, this is from Regina Hall. My husband had COVID-19 in March. He has lost taste and smell. 9 months later, he still can't taste or smell. That's unfortunate. He's not the only one. I have a number of patients who are in the same category. And that's a terrible thing. I remember when I experienced that, I was worried myself. I wondered if it would come back because I love cooking. I actually like cooking more than eating. I really do. And it's exciting how you can affect taste with spices and everything, and cooking it and getting that perfect blend is kind of exciting. It's kind of chemistry. It's a form of art, in my opinion. And losing my sense of taste, wow, that was rough. I mean, I make this really good chicken sandwich. Okay, I love this thing. I found the recipe for the Chick-fil-A, and I modified it a little bit, and it makes wonderful chicken sandwiches, absolutely brilliant. And I was really excited about. So I make like a month at a time. I mean, I just mass cook this stuff because they taste so good. And I got coronavirus, and that was how I noticed the first time I bit into one of my delicious chicken sandwiches, expecting this wonderful, delectable flavor, and all I could taste was texture and salt. That's it. That's it. And I was like, oh my gosh, this is horrible. Can you imagine that? And so I sympathize. It's a really horrible thing to lose your sense of taste. Keep in mind, this virus entered the brain through what? Through the cribriform plate, and it got the nasal, the olfactory bulb. If it causes an inflammatory response there, and sometimes the inflammation is so great that it damages the olfactory bulb. And in those cases, you're not going to get those back, okay, depending on it, because it's part of the central nervous system. And the central nervous system does not repair like the peripheral nervous system. So some people end up with such olfactory damage that they don't get these back. Now, maybe years later they will. This is a new virus. I can't say what the long-term effects will be, but I have known other patients. In fact, just last week, I had a patient with this very same thing, this very same complaint. They got it months and months ago, and they still don't have taste and smell back. And that is a sign of significant olfactory sclerosis, that the damage to the olfactory bulb was so severe that it's offline now. So we don't know. Again, I can't tell you if it will ever come back. I hope it does. But right now, we just don't know. All right. Oh, that's the last one. Oh, wait, is there one more? I think that's it. Yeah, that's it. Okay, we're ready to move on. All right, so what we're covering now, we're talking about mitigation strategies. Our goal,
Dr. Guy?
Yes.
Can you hear me? I'm sorry, you missed my question. It was just on the tail end there.
Okay.
Is a quick question about MS. I'm on immunosuppressants for my MS, and I'm wondering, since an overactive immune system obviously is caused by the coronavirus, do the medications I'm on insulate me in any way?
Yes, if you're on TNF blockers or interleukin-6 blockers, then what that protects you from is not necessarily getting the virus, but the aggressive inflammatory response that the virus generates. You have some protection from that. Okay.
Thank you.
So
Thank you.
Okay. All right. Okay.
Dr. Guy.
Yeah. Sure.
Regina.
Yeah. Hi,
you
Regina.
had mentioned about you don't really work with the children any longer. I for a while was in corporate, so just really getting back into doing the clinical work. I wanted to ask, are there any books that you would recommend, in dealing with, because you're right, it is academic, and one of my young men, he has started having suicidal ideation, but he said that he wouldn't act on it, and I've only met with him twice now.
Okay. All right. Did he say why he wouldn't act on it?
He said that because he felt like he loved his mom and he has two younger siblings.
Okay.
But he is feeling bad about himself right now. He said he feels very ugly. So we talked about some of that being normal, because he is 12 years old and now he's going through those physical and mental changes. But I was just wondering, was there any other things that I could, I am doing affirmations with him. I started looking at that. But he seems to have a really good home environment. He said it started 5 months ago.
Okay. All right. Well, I mean, that's around the age when those hormones kick in for both boys and girls. it does have a significant impact on their brain. So the carefree child person is gone, and they are in a process called competitive elimination. And that's when it really kicks into high gear. So what is happening to your brain at that age? It's not just the testosterone or estrogen, okay? It's much deeper than that. What happens is that competitive elimination, okay, what happens is that when you're born, you have way more brain cells than you need. So you're born with about 200 billion neurons, okay? Now, once you get to this particular age, when you start going into puberty, is that the task of the brain is to reduce the number of brain cells by 1/2. And so what the brain does is it goes through all of your neural networks and it identifies pathways that you're no longer using. There are many pathways that you use as a child that you don't need to use as an adult. And so you target those pathways for destruction. And you use your immune system, your microglial cells, which are normally used to fight infection. Your military for infection is actually tasked with going through your brain and killing brain cells that are no longer relevant, okay? And so that's what happens. And so at this time, their brains are under an inflammatory insult, and that contributes partly to some of these negative emotions. So you not only have the testosterone, you not only have the hormonal changes, you also have these physiologic changes that are going to be taking place for a few years from now. So it's a difficult time. It really is. I mean, it's amazing that we survive it. Okay. One of the difficult things with dealing with children is that, I like to deal with logic, and I try to reason with patients through logic. Children don't respond to that very well, which I find very frustrating.
Okay.
All right. So when people do refer children for me, the number one reason is that they want to know, in addition to medication, what natural things can we do to facilitate a healthy brain? And by healthy brain, you want to enhance not only cognition, but also mood regulation, because the more you can beef up the prefrontal cortex, the better able they are to control their emotions. Because one of the things that these puberty children have going on is their limbic brain is responding to all these hormones, and it's way overactive. And their logical brains, okay, your brain isn't finished developing until you're 25 years old. Okay.
Right.
What that means is that those pathways that feed your prefrontal cortex, the dorsolateral, the anterior, the medial prefrontal cortices, those pathways aren't completely myelinated. And so you don't have full activity of your logical brain yet. Now, your irrational brain is functioning great. Okay. I mean, you got all the emotion in the universe and you don't have any brakes. Okay. And so as a result, you have a mess on your hand. And so now what historically has happened is that you were treated as an adult. When you got into puberty, you were now a member of the adult world. You were put with adults like George Washington. I mean, he had a job at 13 and he was surrounded by adults. Well, that was normal. If you were a woman, you were put together with, if you're a young girl at 13 or 14, you were put to work with other women, wherever that setting would be, and adults. And if you were a boy, you were put with men and you were expected to behave like an adult. And that particular setting, it kind of, when you were going through these emotional upheavals, you were around emotionally stable individuals. And so even though internally you had these emotions, you patterned your behavior after adults. And then the education system came along, and in the 1940s, we started putting children into classrooms and so forth. And then somebody invented the word teenager. And so when that happened, those societal brakes on runaway emotion were taken away. And you put hormonally challenged individuals all together, and they tend to feed off of that. And what's made it worse is social media. Okay, social media and the media in general have created a big problem for teenagers these days. And what happens is that the values of the younger generation have changed so much. And no longer do you have the values of the parents. You have the values of the society at large, because the parents are busy working. And so the primary influences are education and entertainment. And those four sources are saying important people People that are worth loving are smart, they're talented, they can play basketball really good, they're funny, and they're pretty, they're attractive, okay? What about people who don't fall into those categories? They don't matter. They don't matter. And those are, unfortunately, those are the values that are in their head, okay? And that contributes to a lot of psychiatric problems. And so in the therapy, that's difficult to deal with because these are so hardwired in there. And you got, it's an uphill battle to try to undo this, to try to put in the values that you have innate value that is independent of your intellect and your beauty and your talent, okay? But these are some of the problems that we're facing with these kids. And so one of the things that I want to recommend is that, look, you want the brain to be healthy. You want to maximize health. And one of the things that you want to do is that you want to take those individual brain cells, and when you're depressed, the number of synapses per brain cell is around 5,000. When you are no longer depressed, we can prove that synapse number goes closer to 10,000. And so you want to make sure that the child has a diet that will promote a healthy brain. People don't understand that the diet that we are feeding our young American people these days is grossly deficient in nutrients that your brain absolutely needs, okay? And so one of the things that I recommend to all of my young patients and to most of my adult patients is, first of all, you absolutely need omega-3 fatty acids. Most Americans are low in omega-3 fatty acids found in fish oil, flaxseed oil, krill oil. And that is because we no longer eat animals that eat grass. Throughout all of human history, we have eaten animals that eat grass, and grass is where omega-3s come from, okay? Grass and algae. And so because we no longer do that, our depression and anxiety rate skyrocketed when the farmers went to grass-fed animals, okay? It really made a huge difference in the emotional stability of our population. And it's very easy to fix. Take flaxseed oil, take borage seed oil, take fish oil, take krill oil, any one of those will give you omega-3 fatty acids. And what do omega-3s do? They allow your brain to make serotonin. When we give people Prozac and Lexapro, what we're doing is we're blocking the destruction of serotonin. When you take omega-3 fatty acids, you allow your brain to produce serotonin. And so we want our children's brains to have more serotonin. Serotonin reduces that sense of restlessness. Restlessness contributes to anxiety and depression. We've got studies using omega-3 fatty acids showing that actually even in cases like bipolar disorder, it was as good a mood stabilizer as lithium, okay? That's very powerful. So one of the things that I recommend for all my young people are omega-3 fatty acids, 3,000 milligrams of fish oil or krill oil a day or flaxseed oil, any one of those. But that's really important. That vitamin D3 is another thing that's very important for our central nervous system. And in Michigan, because of the low amount of sunlight, most Michiganders are low in vitamin D. Your brain needs that for normal functioning. So if you want this kid to not have depression and anxiety, one of the things they need to have is adequate amounts of vitamin D3. Okay.
Okay. I
Those
better
people,
get you back targeted.
what's that? Oh, okay. Let's see. I'm gonna go.
Yes, I have a question.
Sure. What's that?
I encourage my clients not to think, oh, this is bad, but other people have it worse. I'd like to know just two things that I could say to my clients when they're just looking at doomsday. Two statements of encouragement. Maybe I'm already doing this, but maybe you could expand on that a bit.
With regard to, I mean, are you talking about COVID patients or?
Yes, the whole COVID pandemic thing.
Mm-hmm.
My daughter's a cardiac perfusionist, and I hear so much from her that's frightening, like the ECMO machines and that, the heart-lung bypass machines, they're running out of parts for that. It's getting worse and worse. And when my clients come to me and say, you know, tell me give me a ray of hope. Could you just, give me a ray of hope? Sorry to be so lengthy.
Well, yeah, I mean, like all infectious diseases, they have their time and then they're done. I mean, eventually, this is an RNA-based virus, which means that it's mutation eventually viruses mutate over time. And when they do, they become less virulent. generally speaking, okay? Because right now, this thing is very well adapted to create sickness, and it's related to the sequence of those spike proteins. Now, because it's an RNA-based virus, it's mutating over time. We already have multiple variants because of all the mutations that have taken place. Now, Spanish flu, from the 1920s, by the time you get into the 50s, it had mutated so much, it was no longer a threat to anybody because of all the mutations that took place. RNA-based viruses mutate much faster. And so there is no way that this thing is going to continue to be a problem. It can't. And so it's just a matter of time. Now, with the development of the vaccine, that time is going to be much faster. Okay. And so it's definitely, this is for sure not going to be unless some new virus follows on its heels. This is not something that's going to be around year after year after year. It's not possible. So, I mean, as bad as it is, this is transient. It's all transient. So for those that survive it, I mean, for those that have it, I mean, the protection is incredible. The likelihood of getting it again is very, very low. And as people get vaccinated for this and people that have had it together, there will be an immunity and this will be gone. There will be a restoration, presuming that there's not another new fabricated virus to come along after this one. But the future is, but the question is, I mean, financially, the damage is being done. Eventually, we're going to adapt and come back. But, it's just right now, it's something we have to go through. This is the way it is. But it's not, I mean, in terms of looking at the future, it's regarding coronavirus, it will become less of a threat over time. It's guaranteed.
Thank you.
Sure.
Thank you.
Yeah.
Hi. So things that you recommended that would help to reduce or increase the chances of not getting the coronavirus. You talked about making sure that the iron is high, the omega-3.
Okay. That's for the iron thing is for people that are suffering from post-COVID fatigue, post-COVID, the long COVID. I don't recommend iron supplements for everybody. Because it's not low iron that's the problem. It's what your body does with the iron. Okay. And so COVID causes iron dysmetabolism or dysregulation. And so it's not that there's not enough iron. It's that your body is not able to put the iron in the right places so that you end up with a severe anemia. Okay. So, so during the infection, taking iron is not going to help you very much. Okay. Now, what I did recommend to bolster your innate immune response was melatonin. Okay. Right. Even 1 milligram a day is good. Okay. I also recommended citicoline.
Right. Okay. That's 250 milligrams.
That's fine. That's fine. Okay. And acetylcysteine is another one that is helpful. Okay. And acetylcysteine, usually available in 600 milligram capsules. And you're going to want to take maybe 4 of those a day. If you're combating fatigue and brain fog, I would recommend 2,400 milligrams a day until you start getting better. Okay. And acetylcysteine crosses the blood-brain barrier and has direct anti-inflammatory effects. It has antioxidant effect. So it is very neuroprotective. And so when it comes to recovering, it's a really good thing to take. Okay.
And the omega-3s and the vitamin Ds.
Yeah, vitamin D3. Yes.
How much omega-3?
I usually recommend 3,000 milligrams a day.
Mm-hmm. Thank you.
Not to cut in exactly, but I also want to remind us as we are gathering this information that Dr. Guy is giving to us that our code of ethics suggests that we will not be the ones making these recommendations to our clients. It would be our responsibility to recommend maybe a psychiatric assessment with Dr. Guy so that he can make those recommendations directly so that we are protected within our scope of practice. And so I just want to...
This is for you guys, for yourselves and your families.
Thank you, Dr. Guy.
Dr. Guy?
Yes.
I had a couple questions on TMS. I put them in the chat there, but I don't want you to miss some.
Sure.
How about can people who get TMS treatments expect an immediate response of any kind, or is this something that takes, weeks before they feel something? And then also, what would be a natural, a general recommendation for how many sessions for a first-time client, and will it last? What's the longevity of TMS? Is it something that fades, or does somebody have to come back, every year to continue treatment?
Okay, good questions. Good questions. I need to get my magnet out so I can remember everything you said, though. All right. In terms of how long before you start getting better, typically people start noticing a difference in the 3rd week of treatment. Okay, that's probably the average, is where the patient starts to notice it. The family members tend to notice it late in the 2nd week. That's what happens typically. However, I have had patients that have not noticed any improvement until like 4 weeks after the last treatment. So that does happen. So it is variable, but I would say most commonly the 3rd week of treatment is when most people start to notice something. Okay. In terms of, what you're doing is ultimately you're stimulating synaptogenesis in the frontal cortex. Okay, that's ultimately what we're doing. And we know from a number of studies recently that that is the key to resolving the depression. When you see increased synaptogenesis, the patients feel better. And you can actually, if you measure synapse density, you can pretty much know the severity of the depression by synapse density. The lower the synapse density, the greater. You can look at the HAM-D scores. HAM-D scores go up with lower synapse density. You increase the synapse density, HAM-D scores go down. Okay. Now, we can't order that test. It's a nuclear medicine test using radio-labeled carbon-11. And so that's not a clinical test. It's a research test, unfortunately. I wish we could do it because I would love to show patients the difference. And so when you're doing TMS, what you're doing is you're forcing that synapse density to go up. You're not giving them a choice. With medication, there are many ways that medication can fail, okay? There are several biochemical mechanisms by which medicine won't work, okay? TMS overrides those, and it directly goes into the brain, and it pushes it. Now, does everybody get better from TMS? No. And I try to improve our percentages by being selective about the patients that I do. I've learned over the years that some patients don't get better with TMS. And so I try to exclude them. The patients that are least likely to get better are patients in active substance abuse, patients that are on high doses of benzodiazepines, and the literature supports that. In the clinical literature, people on high dose benzodiazepines don't get very much benefit from TMS. So I try to exclude those people. People that are going through an acute trauma that is responsible for their depression. If you got somebody who's in the middle of going through a divorce, they're losing their house, they're about to go to prison, they have a family member that's dying, no, this is not going to make that go away. And so it's unreasonable to expect, just because your problem solving abilities go up, it doesn't make these stressors go away. And so I don't want to waste their money on that. I've had bad experiences in people in those groups. So I try to exclude them so that our success rate in terms of the people that definitely have improvements in their depression rating scales is over 90%. Okay, it's definitely over 90%. But
so not anybody can just say I want TMS.
No.
You're going to assess them and
Absolutely.
possibly de-recommend it.
Absolutely. Absolutely. If they are actively suicidal, I would refer them to ECT. Because TMS takes a while to kick in, and if they're actively suicidal, I don't want them offing themselves on my watch. So if they are actively suicidal, I refer them to ECT. It works quicker, has similar results, okay, and there is some risk of a little memory impairment, but we try to reduce that by the way ECT is done today, so it's not so bad. But I would recommend, if you're actively suicidal, ECT is a better choice.
Okay, and lastly, how about long-term effects?
In the clinical studies, it's been tested out to a year, and it's still working pretty good, even a year out. I do have a few patients that like to get touch-ups. So they come in and they get it every so often. They come in for a touch-up, and that happens. But most people do not. Most people, we leave them on their same medicines. And once TMS is done, the medicines that used to not work start working again. And so
Great.
we don't have to keep giving them touch-ups for the most part.
Thank you. I'll let someone else ask a question.
Sure.
Is TMS the same thing as electromagnetic pulse fields?
No, electromagnetic pulse fields is a general term, and that can include direct stimulation as well as transcranial magnetic stimulation. So, I mean, that's more of a general description of neuromodulation using electromagnetic pulses. But it's related. I mean, it's in that category. It's just not specific for TMS, I don't think.
Dr. Guy, regarding COVID-19, has there been any efficacy on different masks, or like charcoal impregnated with silver versus the different layers, or is that something you've seen research that makes a big difference?
Well, having an N95 mask is going to give you actual filtration. Wearing a cloth mask, all that does is it reduces the risk of you spreading your droplets into the environment. That's all it does. It doesn't reduce, the evidence shows that wearing a cloth mask does absolutely nothing to reduce your risk of COVID. That's like wearing a net with, 1-inch holes to filter out a BB. Okay. It's like, no, it's not, it's not going to restrict the virus at all. Not at all. It's like fishnet to stop a BB. It's not going to work. An N95, now you have something that's more likely to actually stop the droplet spread of COVID to you. Okay. So there's that. Regarding silver impregnation and so forth, I haven't seen any literature on those yet. I haven't looked, so I can't answer those questions.
Okay. There's also, I just ran across some research out of University in Texas that some work with charcoal as encapsulating the virus. Have you seen any research on that recently?
No, I haven't, but it does sound reasonable. Charcoal is very useful for that very purpose. Charcoal is a wonderful filtration agent, and so it makes sense to me. It absolutely makes sense to me, but I haven't seen the literature, so I couldn't answer.
Okay. I ran across that on charcoalhouse.com. They referenced the article. I started reading it, but it was a lot of medical jargon. So you would probably, thank you.
Yeah, sure. No problem.
We probably have time for about 1 or 2 more questions, depending on the length. If anyone has a question that they would like to ask Dr. Guy or Lindy.
I would just like to know if wearing a shield in addition to a mask is productive.
Oh, of course. Of course. Yeah. I mean, you're basically, what you're blocking are those small droplets. If somebody, I mean, most people wear their masks now. I mean, initially there's always some holdouts that you go to the store and you see somebody without a mask and everybody would stare. Now I have not, every time I've gone shopping, I haven't seen one person without a mask. Now in the maskless state, if you were to sneeze, those droplets would hang in the air for like an hour. And so anybody walking through that area would be at risk. If you are wearing a mask and a shield, the likelihood of those droplets finding their way into your nose are greatly reduced. Every additional mitigation strategy reduces the risk of you getting infected. So yeah, the shield does confer, because it blocks your eyes as well. If you're using a shield, then your eyes, because that is a port of entry, is your eyeballs. So if you were to walk through somebody's sneeze field, you could get it through your eyes. All right. And so, yeah, and some people only wear their mask from the mouth down, so, I mean, they've got multiple ports of entry there, but of course, cloth masks don't make any difference anyway. So I guess it doesn't matter.
Thank you, doctor. And
Sure.
Your seminar has been wonderful. Thank you.
Oh, thank you. Thank you. Thank you very much. I appreciate that.
I got one more question. I can't help it. Do
Sure.
we know the micron size of a coronavirus molecule?
I would have to look it up. I don't have that memorized. I know.
No worries. Thank you. Thank you
Sure.
for a wonderful presentation.
Thank you very much.
Well, Dr. Guy, I just want to say thank you for your time and just invaluable information that you continue to share with us, both in this type of forum and individually, and of course with our clients. So thank you so much for sharing your invaluable time. Much appreciated, and so much great information. I do see Leslie's face on the Zoom call, so I wasn't sure if she wanted to say anything or pop in.
Hi there. Can everybody hear me? No, I just want to thank Dr. Guy. That was excellent as usual. And thank you, Lindy. I was about to start typing, but actually that's better to say it. So thank you, Olivia. I know that Lindy's portion was a little bit rushed and she may have more to say. So if you guys are interested, let me know. Most of you have site-specific meetings every month. And we would love to have Lindy come in and talk to us if you guys are interested. So just shoot me an email if you think that might be. I know some of my site leaders are on this call today as well. Oh, Gina's baby, he's so cute. So just let me know if you think that would be helpful, and we can arrange it with Lindy to pop in and talk to you a little bit more about TMS, because I think it's really important in our Refresh Michigan community that we are utilizing all of the resources that we have available to us. And Dr. Guy's not kidding when he says he definitely screens the patients that that he feels would be helped through TMS. He has quite a conservative approach. So please know that as well, that that is done accordingly. So thank you both, Dr. Guy and Lindy. I really appreciate it. This was excellent.
Thanks for having us.
Thank you, Leslie. So I think it's about 2 minutes before the time that we promised to wrap up. So I have a 2-minute spiel that I would like to give. If you are interested in presenting for our Peer Professional Development Institute, I have put my email in the chat box. It's odixon@refresh-mi.com. I would love to talk. We're in the process of putting a team together, and it is a fantastic team that you would want to be a part of. And we're going to have our first team meeting come January. So if you are even remotely interested in presenting for your peers, please reach out to me. I would love to have the conversation. And I see some people that I've already talked to that's on the call today. Dr. Guy is a medical doctor. And so some of you might say, wow, that presentation was very scientific and research-based, which all of our presentations will be, but he's a medical doctor, we're clinicians. So don't let this intimidate you for not participating, because we all have value within our Refresh community. So I would like to thank Dr. Guy and Lindy again. Thank you, Leslie Johnson, for providing this platform and this opportunity. If you have a unique name on your Zoom box, if you could just stay back and tell me what your name is. I have been taking roll call, and so I want to make sure that I account for everyone. Elise Redding will be emailing everyone the if Dr. Guy allows the presentation, but definitely an evaluation. Once you complete the evaluation, she will then send your certificate via email. So thank you guys once again. I'll be hanging back if there's any additional questions, but I hope everyone has a safe and fun weekend and do something for self-care. God bless you. Have a wonderful weekend.
Do we have an evaluation?
Yes, it will be sent via email through Elise Redding.
Thank you.
Thank you, everybody. Bye.
Thank you very much.
Thank you.
Bravo.
Thank you.